Our new patient numbers have crazily increased. We have a lot more friend referrals since starting your program. We no longer, I don't know if it's okay to say, but we're no longer doing any external marketing. I also use your posture recommendations without even talking about appliances. It's been very valuable. But I joined your program to see how I could help my son. Hi,
Ken,
Simon.
thanks for joining us. For those who aren't aware, this is Dr. Candice Veneberg, a specialist pediatric dentist who joined my mentorship program over 12 months ago. Where in the United States are you?
I'm located in Scottsdale, Arizona, and my practice, I'm a pediatric dentist, and right next to my office is my colleague who's an orthodontist.
Okay, fantastic. So with my program, Postural Orthodontics, has that broadened your view on what you can do or what you feel comfortable doing?
Absolutely. I have in my family, there is sleep apnea on my side of the family and my husband's side of the family. And my son was growing similarly to how my father-in-law has a recessed jaw. And so not only with the crowding, I was trying to figure out how to unlock the deep bite for my patients too, for my patients and my son.
Do you feel like the treatment that we've done using removable appliances, has that started to have an impact or benefit for your son?
Yeah, absolutely. One thing that for him, it's been a painless process having the removable appliance. The first week, with your guidance and your training, how you have to be strict, I learned to be a little bit stricter, and said you can do it. And I'd seen so many cases, and with your guidance, I've been able to do what I didn't think was possible. He's proud to be wearing the removable appliances, but working on the posture, I think, has been the biggest realization to me about how to avoid relapse, and I want him to continue to grow properly. But the more I go through the program with my son, I realize, oh, even though you said, oh, the posture is so important, I'm learning it even more so, because when he doesn't do the exercises, I can see things starting to look softer. And when he does the exercises, he looks like a stronger jaw, and that we're getting better remodeling of the bone.
How have you found the format of, being involved in a group and everyone kind of putting in some input and sharing their own cases and then providing feedback as well as my own?
So initially when I joined the group, I was one of the doctors with the least ortho experience, because I hadn't practiced ortho in over any early intervention over 10 years. And I actually felt still very comfortable. Everybody gives nice feedback. We're listening to each other. I have enjoyed the mentorship, especially with other doctors on the call too.
Well, and I think that's why we've limited it to, a relatively small group, because everyone obviously needs to present their cases, and I have to spend time. But the vault that we've created of case reports, and every fortnight we record the information. Have you found access to the historical vault to be useful for your own learning?
Absolutely. I feel there's so much content in there. That first year, I think it was 2021, was very, very detailed. And I felt like I listened to those videos so I could be prepared and not kind of, you have to retell me. I try to take the feedback that you were telling other students about camera settings or just different tips with patient management, maybe coaching parents. Also, the vault, the way it's labeled, I could just search OpenBite and I could read other cases and kind of follow that history and some of the comments, and maybe challenges that other doctors had, and then you would make the comments. And then if I really wanted to even dive deeper, I would just look to see those dates and I would go back to the videos. I think that's valuable.
It seems like there's an infinite array of issues to deal with, but you can actually categorize them because they keep repeating and they keep repeating. And hopefully with experience and with time, you start to see the patterns.
I feel that especially those of us that are pediatric dentists, we are used to treating young kids, guiding young children to do hard things. And I think that actually, as those of us pediatric dentists or general dentists that see young kids, um, we have the capacity to guide a patient and intervene early so that we can set them up to have their either skeletal or dental malocclusions less severe the earlier we intervene. I also use your posture recommendations in my pediatric practice alone in young infants and toddlers. Just talking about that in my practice without even talking about appliances has been very valuable. We have a lot more friend referrals since starting your program. We no longer, I don't know if it's okay to say, but we're no longer doing any external marketing. Our new patient numbers have crazily increased, I think, since I've really been talking about posture and air, even more so airway, because now I have the capability of giving some tools to the parents. Like they can feel like they're in control, like, oh, I might be able to actually help my child instead of, oh, genetically I had this, so they're gonna have it. They're gonna have 5 years of braces, like I had 5 years of braces. So it's been that part has been a huge practice builder with just and being able to identify why they have the malocclusion. The parents, it makes sense to them. Simon, I can tell you that the confidence I have in being able to, I'm, starting to look at the face and I'm like trying to guess the occlusion. I'm like, I got it right again. So that, showing that confidence in the parents, they can tell I know what I'm talking about. And I feel confident because I've spent so much time with you, learning it and listening to the videos that I'm like, I know this. It's been proven time and time again how you tell us to read the face. And I'm like, oh, it is. It's that same occlusion that Simon said it was going to be. That's exactly what's going on. So I'm able to read it and see it. And when you see it, it's hard to unsee it. You just want to change and help everybody.
Absolutely.
Yeah,
And the fact that you've actually treated your own boy, then of course they're going to say, hey, if it's good enough for your son.
right, exactly. So I'm very happy that, and now I'm offering it to my patients and they're interested. So it's been a good, and I'll be around for a while because I have a lot more to learn.
Well, I'm very pleased to hear that I can continue to be a part of your education and your life and your family's life.
Yeah. Thanks for the mentorship, Simon. I'm glad it was available. It's
Oh, wonderful.
amazing, but it's amazing what we can do with Zoom across the ocean.